imbalances, this can be the cause of the problem. And that's why in the lifestyle, to choosing a correct space and right place also very important. Physical activities refers to more like a physical exercise for walking, soft exercise or yoga and running and all these things, doing prostrations and so on. And also in the lifestyle which talks about mental behaviors, which is like to studying certain philosophies to get more deep understanding what is meaning of the life, and especially like Buddhist philosophy, and what is the deep meaning understanding of compassion, and what is the meaning of interdependent, or what is impermanent and life impermanent and illusion. And these some specific subjects are also very important for everybody to know some part of it, because which can help us to open our heart or to open our life toward to the universe or toward to the others. And that's why, which is also I think which is an important factor for our health. Medications, normally traditional Tibetan medicines, the formula is divided in two parts. One is called formula according to the taste, and one is formula according to the potency, so which is very typical Tibetan way to make a formula, to make a medicine. And the first one is according to the different taste, and we create a medicine. For instance, this taste for the lung imbalances, and the taste we use the sweet and sour and salty. So that means if somebody has lung imbalances, wind imbalances, and then we use the plants more sweet and sour and salty. And this is a very general, very basic way to make a herbal medicine. But secondly, we should see the potency and the potency of the herbs. In this case, for example, here we see the quality, the oily potency and the heavy potency, smooth potency, and so on. And also it's important the form of the medicine. For instance, some form of the medicine, here we see the pills, some of these forms are powders, some of them they are decoctions. For instance, if there is an urgent case, somebody needs to urgently take a medicine, and then the decoction is more effective. If we drink the medicine, liquid form, it enters in the blood more faster. And if there is a chronic disease, and then it's good to take these pills, because pills they can digest slowly, it enters in the blood slowly, and we believe so that also affects more deeply in the body. And if some other disease is more medium, like in case of lung disturbance, we would use more the powder, so not that fast like decoction, but also not that slow like phlegm. Therefore also we use the powder. So here again we see which herbal medicines, which taste and which potency we used for the bile, these imbalances. So sweet and bitter astringent we used for the bile, and the potency cool and subtle and blunt potency especially used for the bile. Here we see the taste for the phlegm, pungent, sour and astringent, and also the potency sharp, rough and light. These Tibetan medicine and Tibetan doctors, when they prepare the pharmacy, it's very important to know very precisely to know the different type of the herbs and the minerals and so on. Because first the formula is based on the taste, and then secondly we have to know the potency of these substances, and through the substances then the potency of the substances compare to the characteristic of the humors. For instance, one humor has a hot characteristic, and then we the potency use a cold. Or one humor has a rough characteristic, and then the potency we use oily. For instance, here the potency is a sharp potency. That means if one this energy has dull quality, and then we have to use sharp potency. For instance, in the phlegm case, one of the phlegm characteristic is dull or slow, and then here in the medicine is sharp to eliminating. So the basic idea in the traditional Tibetan medicine is more allopathic. So the function of this treatment is coming through the opposites. If there is a cold nature, this cold nature we should balance through the hot. If there is a hot nature, we should balance it through the cold. And also, of course, there are some cases the Tibetan medicine, the hot condition can be treated by the hot treatments, and cold conditions can be treated by the cold conditions. That's depending where is these imbalances in the organs or body tissues, and how it's manifesting and which humor is manifesting. So this part of the study in pathology can be also very complicated. In any case, also in the final tantra, which is mentioned, the hot-natured disease can be cured also with hot antidotes. Here we see the method of the treatments, and especially the external treatments. And the external treatments we see here: kunye, traditional Tibetan massage; horme, which is Mongolian hot or moxibustion. These two are very effective for lung disorders. So lung disorder is mainly like emotional and mental aspect disturbance, and that's why these two therapies are quite good for reducing the mental and physical stress, and also makes deep relaxation. Here we see external therapies for the bowel disorders. And so here we have perspiration, like sweating therapy, sweating with the steams, or dry sweating, and so on. And then second is bloodletting, to study specific bloodletting points. Normally in Tibetan medicine is mentioned about 77 different type of bloodletting points, and these 77 different points are used for the specific disorders. And then we have here hydrotherapy, which is called water therapy, and which is also very effective for bowel disorders. Here the external therapies for the disorder of phlegm. Here should be compress. So compress, normally it is a hot compress and cold compress too, but in this case the compress especially is the hot compress. Hot compress with salt, natural salt, hot compress with bricks and with sand and with hot stone and so on. And the next one is moxibustion. Moxibustion, it's a very effective external therapy, and especially the used in the case of the phlegm disorders. So here is the traditional Tibetan acupuncture, which is, of course, traditionally the Tibetan acupuncture is called the dorje, tormeche. That means therapy with chopsticks. So the needles are quite big and not that practical in modern society. And also in the history text, which says we have been lost this tradition from a long time. But in our study case, we tried to revival this tradition. We used the Tibetan points and using the modern needles, Japanese needles, and to use it, because this acupuncture is used in two cases. One is called the cold needle and one is called the hot needle. And this hot needle used for the phlegm and the wind case of the pathology, and the cold needle especially used for the bowel conditions. Therefore, the acupuncture is very useful for three humors. It is also in the medical text mentioned one of the best external therapy, and we are still doing research